video series Atit Neurology. Let's discuss about essential tremor. Essential tremor is a very common type of tremor. A large part of the population actually has essential tremor. It can be involving the hands, which is the most common. It can be involving the head, uh, and it can be involving both. Sometimes the legs, but that's usually unusual. But most of the times it's the hands. The only problem with the tremor is the tremor itself. It's usually genetic. It's usually inherited, but it starts after a certain age. Starts after the age of 60, but I've seen it even in 20-year-olds. So, but most often it starts at 60, and it does get worse as you grow older. The problems the patient faces is because it can be embarrassing. That's probably the biggest reason why people seek medical attention, because it's embarrassing. Nobody wants to shake when they're trying to eat, when they're trying to write. Their handwriting can be affected because they're shaking so much, and also head tremor can be embarrassing. As I said, it does not lead to anything else. So the only problem with the tremor itself. There are medicines which can reduce the tremor considerably, and we do use those medicines if the tremor is disabling or uncomfortable for the patient, like primidone or misoline, propranolol, which is a beta blocker, Topamax or gabapentin sometimes can be used also. Some patients I have found those useful. If the tremor is very disabling, especially if it's the limb tremor, I can refer the patient for deep brain stimulation, which can completely take away the tremor actually, but that would be a complex procedure usually done in an institute like USF, or Movement Disorder Institute, for the deep brain stimulation for the essential tremor. If it's a head tremor, it can be helped by Botox or botulinum toxin. Alcohol has a dramatic effect on the tremor too, and that's one way actually you can diagnose it to see if the tremor responds dramatically to alcohol as well.